For anyone living in Brisbane during the pandemic, if you experience a dental emergency during lockdowns, you are going to be very glad to have watched this interview with Dr. David Kerr from today's Dentistry. So thank you so much for joining me, David.
Thanks, Lizzie.
So at this stage, the level 3 dental restrictions are in place, and those are different to the government level restrictions. And so I was wanting you to explain in a little more bit detail for people what help they can and can't get, because there are some procedures that can't be done at this time.
Yeah, well, look, it's more a recommendation. And it's basically, we're put under a restriction now, quite rightly, that the generation of aerosols during a dental procedure is to be limited or omitted, if at all possible. Now, it's sort of still up to the discretion of the dentist, and this is where it becomes more a level of urgency. So if people are coming in with problems that aren't necessarily painful or aren't likely to escalate dramatically, those procedures are very likely to be deferred. And those sort of things may include, you know, your routine dental checkups, your visits with the hygienist, those sorts of things. We're really deferring those sort of appointments now because the government's view, and I think it is the right view, that moving forward with those elective procedures now, the risk of generating aerosols, which is just the spray and the water spray and everything like that, even with our hydrogen peroxide mouth rinses, etc., is putting people at risk of spread. So, look, we're still seeing people with rip-roaring toothaches. They can't sleep, they can't do anything. You know, people are breaking their dentures and they can't move on. I mean, there's a whole world of other stuff that we will always argue is very urgent. We've got to get people out of trouble. We don't want them clogging up the health system, which is already under threat. So we are offering services with a bit of discretion, of course, and taking all these other precautions to try and help people out through this period. But a lot of people don't realise, that, I suppose, about any dental practice, that it's a very, very safe environment for cross-infection control, even in normal circumstances. I mean, all surfaces and all instruments are all fully sterilised, disinfected with what we call the universal protocol, which is to protect everyone against infectious diseases that can spread between individuals and certainly to our staff as well. So in this instance, because this virus is quite contagious, there has been some extra things that we probably have implemented that we may not do under those universal precautions. And they come in the form of a hydrogen peroxide mouth rinse, which we get patients to do for two minutes or so before we do anything. And that's very effective at killing viruses that lodge in our mouths and saliva, etc., which is where a lot of the COVID-19 virus is incubating, if you like. The second thing that we're probably doing is being a bit more fastidious with our surface wiping. So traditionally in our sterilisation areas, certainly in our clinical surgical areas, that is a given, we do that anyway. But we're looking at places like door handles, you know, reception desks and things like that. Those areas are now getting really dealt with the white glove type arrangement where everything's getting wiped. And hand hygiene, not just for our staff, which is what we're all on top of in normal circumstances, but we're really encouraging anyone that comes into the practice to observe some really good hand hygiene protocols as well. We're implementing a social distancing. If we've got some people in the waiting room, we want people spreading apart like we're all told to, and that sort of thing. So those sort of things are probably a little bit extra than, you know, our phone screening protocols. Our protocols, which are universal anyway, are still in play, but we are doing some extra things just to make sure we're keeping everyone as safe and as protected, both for our patients but also ourselves and our staff.
Excellent. Thank you so much for sharing that. So if people do experience a dental emergency, I know that you have a guide on your website to dental first aid and how to deal with that. If you could share a couple of bits of insight from that, and what people should do if they experience an emergency. How do they get help?
Well, a dental emergency really, I think, is infection and pain.
Mm-hmm.
I think they're the big ones, and they're the ones that those problems aren't going away. And so if this period of time is going to be prolonged, which we all think it will be, it's not going to be over in a few days or a week.
Yeah.
We're talking probably months at this point.
Mm.
My view is, at the very least, those problems do need to be looked at.
Mm. Yeah.
You know, there's some cases where maybe we can just put you on some medication. We don't do a procedural or a procedure, and that might help you out for now. But there's some problems, I think, that, you know, may need to be dealt with here and there, and it's up to the discretion of the dentist, I suppose, whether that's a good idea or not. So obviously, the worst thing that can probably happen is a big dental infection or a really acute dental abscess, which is a very, very painful situation. Or alternatively, if someone has an accident, I mean, everyone's going a bit stir crazy at home. You fall over and smack your mouth on the coffee table and knock your front tooth out or something.
Yeah.
You really do need to get on the phone to someone straight away and work out what the management plan is. Almost always we can talk you through what to do. We can see you very quickly.
Yeah.
Those sort of things are urgent. They do need urgent attention. And look, we're open and around to try and help people with those sorts of things.
Yeah. Excellent. So if somebody needs to get in contact with the team at Today's Dentistry, how can they go about doing that?
Look, we're pretty available. Look, I mean, it's our phone number on the website. Look, they can contact us via email. We've got a web chat link on our website as well, if that works. Even via Facebook, I think these days seems to be the way people want to communicate. Sort of available through a whole bunch of different channels, even if we're not here.